Okay, hi everyone. Welcome back for our last session of the day. I'm really pleased to be able to introduce Vanessa Pinfold, who is the co-founder and director of research at the McPin Foundation, which, as many of us know, has been a really long-term and really valued involvement and engagement partner of SPHR. So Vanessa will give a brief presentation and then hand it over to our public panel, chaired by Jillian Samuel, and hopefully we'll have some time for Q&A at the end. So Vanessa, over to you.
Thank you so much. It's an absolute privilege to be here, and just taking in the morning talks, I feel like I want to start with just saying fantastic innovation. It's been so fantastic to be in a face-to-face event with a bubble machine, standing up and down every time people come in, clapping people. It's absolutely fantastic. So it's really lovely to see the innovation that's been put into this event, and I suppose that's a theme with public and patient involvement work. We're really trying to pioneer innovation. And what I'm going to talk really briefly about today is some of the things that we think are quite important at the heart of that innovation. And my title might be a little bit controversial, considering that we've had the most amazing talks today from public partners with their crocheting and the incredible banners, talking from the heart, young people talking about why it's so important having researchers in their school. There's something about the rawness, the powerfulness of this, the connection to lived experience with the academic is something that is at the heart of the work that we've been doing at McPin, and we want to share a little bit of that with you today. And in my kind of preparation for this, I was thinking about what's the best way of approaching it, and I was thinking, you don't really want to talk to me. You don't need to listen to me. We need to listen to people who are at the heart of our work. So we're splitting this into a bit of an organisational perspective of what we've been trying to achieve and what we've been doing with the School of Public Health Research, and what we hope everybody here will carry on this journey, because there's innovation everywhere. And we've got your back, and we're behind you on that, and we learn from each other. I mean, that's the other thing. There's no blueprint. There's no one thing. There's no one way of doing this. There's lots and lots of different ways, and bringing in different kinds of audiences, whether it's parents or carers or kids, whether it's people with mental health problems, whether it's people living in a community that might or might see themselves as disadvantaged or not, of people that are in racialized communities, migrants. There's so many different groups that we want to bring in and help make sure our research is relevant for. So much of this work is about making it relevant and useful for the communities in which we live and other people live, in order that we can live in a compassionate, kind, progressive society. So PPIE is at the heart of all of that work. And this artwork is something, so we've just turned 10, so we've kind of been like on a bit of an exploration of what have we learned. This piece of artwork was chosen by our staff, and its message is valuing vulnerability, because at the heart of PPI work is an element of vulnerability, and we see that as an asset and a strength. So we talk about community assets, but in our work, in our academic work, we see that as a strength. So yes, McPin, if you haven't come across, is a small organisation. We are our people, so there's some pictures there of my colleagues. We have a young people's team and we have like an adult team, but we work jointly. And we've started to try and write about some of our experiences. So if you're interested, do look at our website. We've got a whole load of resources about PPI, co-production, co-researchers, working with young people, et cetera, and we really want to learn from other people too. So that's the kind of message that I can't stand on this stage without the work of all these people, including the trustees, the volunteers, the consultants that we work with. And yes, we have a portfolio. It's a biopsychosocial portfolio. We work across mental health research. We also started to work in other spaces too. So the talk this morning by Sarah and Hayley really resonated with me, because we at the moment are working with the Peace Alliance. It's part of the Black Church in Haringey. And we meet at Tottenham Town Hall every Wednesday, and it's a youth-led project of 12 young people trying to address school exclusions and looking at root causes of knife crime through thinking about how school exclusions are part of the pathway. So I said to them, we definitely want to get that beautiful piece of crochet work to London in order to kind of amplify the work that they're doing around Project 2999. Again, it's about partnership building. So our portfolio is broad, but one thing we really value a lot, and it was brought up earlier about how do you support researchers, mentoring and supervision and well-being is at the heart of the McPin Foundation. And again, we don't have all the answers, but in academia, sometimes some of the things, we work at such pace. And in a sense, what I find sometimes is it's not just the research interview that can be difficult. It's actually then going back to the transcripts and reading over and over again what people's stories can be. There's lots and lots of points on the pathway. It might be part of an epidemiological study that something kind of hits people, but there's lots and lots of different ways in which we need to make spaces for reflective practice and well-being, and that's what we're trying to do. So, as I said, there's kind of like a starting point is that we think you can do university-styled quality research in the voluntary sector. Not everybody agrees, but we can only do that with partnerships with people like yourselves. But that's our aspiration. In the last 10 years, we've been part of over 100 peer-reviewed journals. The staff have been part of over 100 peer-reviewed journal articles. So this isn't about infographics and videos only. It is about contributing to the academic literature, and we're really keen to do that in kind of methodological ways. But we believe that people with in our case, mental health problems, but the public, are an absolute vital ingredient in research, and I think people here agree with that. But one of the things we've been trying to think about is, what is it? What is that expertise? Because it is expertise. You have lived and living experience, and then you come into a research context and you develop an element, and someone said to me earlier, professionalism. But you do need to sometimes understand some of the research language and lexicon and have an interest in research to bring that fusion together, to have that lived experience expertise. And whatever it looks like, it's different in every project. But it is something. It is something special. It's learned and lived knowledge. And through that, we contribute to projects in various different ways. But like lots of our work, this is complicated. People aren't only lived experience expert. They're also a clinical academic. They're a parent. They're a artists. We all have lots of different skills. And I suppose what this kind of work kind of brings to the surface is we have lots and lots of different things to bring to our research, and some of those identities remain hidden for reasons of stigma or reasons because they might not be seen valued. One of the things that strikes me is that the REF does not value PPIE work. It values teaching and research grants and publications. But the work that you do in terms of involving public partners and spending time, there was a presentation recently at the Public Mental Health Symposium, and a researcher had a grant for a year to go and embed herself within a community organisation and created amazing partnerships and was a rewarding and reciprocal relationship built. But at the same time was not doing peer-reviewed journals or grants, and kind of said, I have to put my academic career on hold in order to do that work because it's not valued. It's valued by some parts of the ecosystem, but not everybody. So we're interested in conversations about how we can increase systemically and structures around public involvement and work. So it's not the add-on, it's not the thing that we all know we need to do, but it's something that's recognised by the academic system too. And the only other thing I would say is that we're a little bit particular about language, and there is something about really understanding about the difference between research participation, research engagement, and research involvement. And lots of these things overlap. But I think the work of McPin is really trying to fly the flag for involvement, paid public partners that are getting involved in substantial ways. And they get involved in different kinds of models. So I said it's not one size fits all. So one of the key things for me is thinking about the breadth of different kind of models. Some are methodological. Citizen science is the latest thing that people are talking about and thinking about that as a public participation model, participatory action research. But you also have co-production, peer research, which you can embed in a randomised control trial, and you can have a lived experience advisory group in an epidemiological public health study. There's lots and lots of different mechanisms that you can use, and there's lots of different roles. So this is one of the graphics in one of our reports. There are so many different roles for the public. So it's about expanding that and working on that and thinking in some sense about careers, but it's not all about careers. Sometimes people just want to fly in and fly out of a project, and other times they want to actually maintain those strong relationships with you long term. And the key thing here, I think, is flexibility. So one of the things I think that's really difficult is to open up spaces in our projects for lived experience leadership. It is really difficult. And the reason I chose the term tokenism to meaningful involvement is because we struggle with that all the time. The risk of extraction, the risk of just diving into a community and doing a project and then running away, it's so difficult. And so I just wanted to kind of elevate the thing that we are thinking about lived experience research leadership, and I know you are too. And one of those things is thinking about how public partners who want to can become co-ops on grants and can be given the skills and experience to do that. Because often I see people as co-ops, but they're not given the support, they don't understand what that role is, and there aren't lots of support sometimes around people to do that. I'd love to have an action learning set with lots of public partner co-ops, because I think it would be fascinating and would be really, really helpful. But embedding this kind of work right across the kind of structure of research and thinking about those opportunities. So, tokenism. I think the key thing is always to remind ourselves that it can seep in and it's challenging. And what we're trying to do is to kind of counter that. And I don't want to kind of land on that side for long. I want to think about how we can move from tokenism to involvement. And some of these things have been said already. which is absolutely fantastic. So thinking about building rapport and trust with community organisations and prioritising those relationships. A lot of the work that I've done has created friendships. When one of the conversations earlier, I was thinking that the way it works is that you have to give of yourself. You have to invest time, and it's more than, it's about getting to know people. And a lot of that means the relationship lasts a lot longer than the research project, because you end up feeling like you've built a strong partnership and you've built some friendships. Creating inclusive teams and team ethos, this is where co-production comes in. Co-production is really, really helpful because it's got some principles and values around it. A lot of the work that we do is trying to embed those principles and values in structures and teams that might not be the norm. And that's not the people in the team's fault, it's the structures around them. Academia is very hierarchical. So one of the things is about sharing power and working differently. And it's really easy to say, it's much harder to do. But I think this is one of the things that we're trying to think about in a productive space and a helpful space of how we can do that. At the end of the day, a lot of the answers do relate to money, and we have to resource PPI work well, and we have to find ways of potentially giving micro grants to community organisations. I thought it was, some of the programs that you're working on are doing that. Again, Hayley and Sarah said, look at what we've achieved with £3,000. Look at what they've achieved with £3,000. I think the route to kind of community grant making is a really, really powerful tool, and it'd be great if we could do more of that. The other point is linking to that vulnerability, the emotional labour that goes into our work. And I suppose it's about building teams that value that emotional labour. And I think that's the other thing about moving from tokenism to meaningful involvement, where we really are thinking very carefully about how we do that. There's a lot of being written in the mental health space about this. I'm going to hand over to you. Is that? Sorry, I'm just having a freak out about the time. No, it's fine, it's okay. It's like 3 minutes to go. I'm thinking half an hour. It's okay. I'm not having a heart attack again. Right, okay, I just wanted to really briefly say, like, a really good example. So Gillian, fantastic, a colleague of mine, came to work for McPin, 3 years ago? 5 years ago.
I know.
See, we haven't aged. 3 years ago, and we set off on a journey to try and think about how to build a public mental health, like public partner program in public mental health. What is public in public mental health? And we ended up interviewing 50 people because we couldn't choose by looking on paper who had the right expertise. Everybody was relevant. So we went through a very, very detailed process of trying to choose some public partners. And they went through a detailed process of trying to develop some ways of working. And they were inserted into a program that had already been funded. And you know what it's like. It's already been set. We're doing these things. And then you're trying to insert people into it. So in that first 18 months, they did a reflection exercise of what had gone well and what had gone less well. And we got to part 2. And the program listened. And in part 2, quite a few things were turned around. A buddy system was put in place. So the reciprocity of learning between the academics and the public partners was established as a really core part of the programme. And they gave us a peer-led project. They gave us. The powers that be allowed us to do a photo voice or photo elicit project whereby we went out and explored inequality and mental health in 2 communities in London. And we have published it in a peer-reviewed journal. So we're proud of this journey that we've been on, and I really wanted to hand over to Gillian to talk with some of our public partners about across the pan, so not just McPin, but this was a call that we put out to the public advisory network that's part of the School of Public Health Research, and we asked people who in the part of the pan who would like to come and sit on the stage and share this space and talk to you about their work and about what's important to them. Gillian.
Thanks very much, Vanessa. It's great to be up here again, second time. So, yes, as Vanessa said, we have invited our public partners here. Thank you very much for choosing to be up here and take the stage. I have a question, first of all, 2 questions for Hamid, which I'm going to ask, and then I'm going to follow that with Peter, who's going to have a further 2 questions. Okay? So, Hamid, your question 1 is, Can you tell us why you got involved as a public partner in health research, and what is the most important to you in terms of how you are involved?
I'll take that in two parts. So I got involved in public health research as a layperson who had no insight into the world of public health research. And even though at the beginning it was by default, it was curiosity, but once I got in, tasted, I realized that I want to be involved because I had noticed that not many people who represented certain communities or represented people of my community were there, and the population of the UK is very diverse. So that was one of the reasons I got involved, is that I wanted to make a difference in terms of sharing my own personal experiences, but also relevant experiences that could help researchers when they're looking at involving and engaging people from different communities, so that when research projects come to an end, they would benefit the population as a whole rather than certain communities. And that was one of the reasons I got involved. And the second part of the question?
So it's about why you got involved in health research, and what is the most important to you in terms of how you are involved?
I think what's important for me, and it stands out when you know that it's meaningful and you're being valued and you're there because people know that you're going to bring a certain insight or you're going to share certain ideas, and they're very serious to take what you say on board. Very easily you get to notice, and I'm personally, I think other public partners say, you very clearly pick up when you're just a tokenistic and you're just there for the sake of it. So what I would say to researchers is that when you're involving people, ensure from the onset you check in with your values, what is the reason, and how you're going to make sure that it's meaningful and it's going to empower everybody around the table. And I must say, I've been very lucky. 99% of my experience has been where I felt part of the research team. I'm not an academic researcher, I'm not a clinician, but I felt equally valued, that in a sense, my perspective was just as valued as a clinician or an academic.
That's a very powerful message. Thank you very much, Hamid. I have a second question for you now. So do you feel that your involvement in general across all of your work in health research always has an impact, or just sometimes? Can you explain why this is?
I think it would be very living in an illusion if I said always. That's not the case. I would definitely say sometimes, more often than not, because the truth is that when you are there, sometimes, and this is no disrespect to researchers or academics or clinicians, but we say things as they are, and sometimes the way I see things, academic and clinicians don't get to see that. It's a bit like a number 6 on the floor. If I'm standing on this side, it's a 6. If you're standing on that side, it's a 9. And we're both right, but you're not seeing the 9, you're only seeing the 6. And that's how it is like for being involved as a lay person. You really give and say things, and sometimes we know what would work and what hasn't worked because we've got real lived experience of what they're trying to find out through research.
Very much. It's a very important point you make about impact, and that's something that actually shouldn't be lost, that the impact that the public has when they take part, where they're involved, should somehow be captured, as in the impact log I was talking about earlier. That's just one way that you can do that. Thank you very much, Hamid.
Thank you.
I'm going to, if you'd like to pass over to Peter. Welcome, Peter. Thank you very much for joining at this panel today. So I have 2 questions for you. And the first one is, I know that you have worked with a range of people and panels. What are your top tips for ECRs thinking of doing PPI for the first time?
Thanks, Gillian. It's a pleasure to be here. My tip would be have a conversation, because you will be amazed how people like myself, patients and public, are really interested in what you're doing. And, I have a passion, but I'm not alone, yes? So research is about people, it's for people, it's with people. And, I have a passion for PPI because I genuinely think it makes a difference, a positive difference. And I'm genuinely interested in what you're doing because it's about life. and it's very inspiring. But my tips for ECRs would be just have that conversation. Don't be afraid to just tell people what you're doing and be open to a conversation. And, don't just sit in a little bubble. Just reach out to whoever, friends, someone else, and you'll be amazed. And building contacts is also very important. The great thing about this is networking, isn't it? Where, we get to meet people and we build up, contacts. So that would be my tip. But just don't be afraid. Just reach out, and it's a wonderful experience.
Thank you, Peter. That's a very good answer. And something which I would agree with, Peter, is that sometimes people have sort of come up to me shyly and said, if they're early in their careers and they're sort of, I want to know about PPI, but I don't know how to do it. And it's as simple as opening the conversation. Don't be shy. It's something that you can learn, you can become accustomed to, as long as you are brave enough to come forward and ask. So thank you very much. It's your first question. Now moving on. Have you finished? Sorry.
No.
Oh, sorry.
No, the second.
The second question. You ready for the question number 2, your final question?
Okay.
I feel like Robert Peston. So, Peter, you've shared with us that for more than 20 years you have been an active public partner, sharing your lived experience. Can you describe how you think that public involvement in research has changed over time?
Yeah, thank you, Gillian. Public involvement's been on a journey. My experience does go over 20 years. As a patient, I was in an alcohol detox 24 years ago, and then in a treatment centre. And through gratitude, I really wanted to get involved in recovery and to share experience. And yet I found it, you'd go back and people would ask you token questions, and it was like filling out a form and being offered a cup of tea and a biscuit. And yet really what we're talking about is shaping research and commenting on programmes and, how things, and, looking at the impact of what you're doing and how it makes a positive difference. So this journey, and I will say I was lucky, a friend of mine, Alice, did a PhD at Liverpool University, someone else was mentioning Liverpool, on public involvement. And by talking to her, I suddenly realised if you reach out to people like NIHR, there's a massive amount of work across all the programmes, and all the sort of Royal Colleges, etc. Because more and more everything needs a public member. And even at NIHR, things like infrastructure and everything now, annual reports, they all get a public review. So whilst my work is around addictions, and I'm passionate about that, but I'm equally passionate about public involvement, and always in a supportive way, never in a critical way. We are critical friends, but we want to make that difference. We want to see what the impact is. We want to see how you've reached the underserved communities, how, your approaches and, and I think this idea of tokenism, I mean, it's not, sometimes people just write grand sentences, but you really want to know, illustrate it, give me a case study, give me an example, yeah? And I've come across some amazing examples of how public involvement, I remember a clinical trial where they actually said, on autism, where a public member said, you're measuring the wrong thing, and the public member was right, yeah? And that set up the COMET initiative, the Core Outcome Set initiative in Liverpool in the northwest. But so it's extraordinary. But lived experience has shaped health research, whether we realise it or not. So it is actually about, and as Hamid said, I agree, I've sat on panels and committees where very much being treated as an equal partner. We get the same amount of time, we get the same, yeah? So feeling valued and feeling that you're contributing in a supportive way. Mm-hmm. I think that's more or less what I've got to say, unless you want... and we want everything as well. We don't, half measures don't do me. If I'm reading a PhD, I want to read the whole thing. I want to read the detailed research. Mm-hmm. Obviously I focus on the PPI and the plain English summary and the scientific, but I want to look at the governance and how the funding is, and because, we want to do it properly. So just to be treated with respect, which is what we want to, we want to make that difference with you. We want to work with you in a supportive way. With pleasure, thank you.
Thanks very much, Peter. You've made some very important points there. So, does that bring to a close our presentation?
We've got a little time for questions.
Yes, I wasn't sure. Yes.
if anybody's got any questions for us, we'd be pleased to take them.
Thank you so much. Is it on? Is it on? Yeah. Thanks so much for those insights. They're very valuable. So I've been in the field of public health research for a long time as well, more than, in fact, nearly 40 years now, and have seen incredible changes. And I wanted to pick up something that you said, Vanessa, which is that you need to give of yourself. And that is a massive change across time. And I think there is some need, and I'd be interested in the reflections of the panel as well, on how you manage that, because actually that's not an easy thing to do. And I know in McPin you've got a lot of expertise in that, but it can be very scary, I think, for people. And as an epidemiologist, of course, when I started out doing epidemiology, population studies, you were supposed to absolutely not do anything like that. You're basically doing standardized questionnaires with as high a proportion of the relevant population as possible, in order to identify things in a standardized manner. And so we have to try to manage the tension between trying to create generalizable findings with that absolute need for engagement, co-production, empathy, and as Callum was saying, not helicoptering in and out. No.
It's a fantastic question, Carol, and we could run a workshop on it. But just brief reflections. One of the projects, we try and create spaces that are comfortable for everyone. So everybody has to come in a project, in terms of co-production. We sometimes feel that we kind of have to land that kind of icebreaker in the right way, like read the room, as it were, because sometimes people don't want to be sharing lots of personal information about themselves, and why would they? It's a workplace, so we have to be really, really careful. And one of the things we do at McPin is people choose their job titles. So there's lots of choices involved. So whatever project we're working in, we have to be really respectful and try and work out around the choices that people would make. And the reason I say that is I was involved in a study where we were looking at acute day units, psychiatric day units, and I was just curious about why people were working on the study. So we did this little reflection piece of a survey at the beginning where people talked about why they were interested, and the statistician said, because I was asked and it's interesting, and a psychiatrist said, because I don't want it to close, because I've got a vested interest in this, I would just say that. It was really interesting to go around and find out and write down what everyone's perspectives are, because everyone did have motivations for being in the room, and then we could put them aside and do the science, and then we could come back again and reflect on it again and think about, had our view changed? Were people more passionate or less passionate about it? So I suppose it's about surfacing all of those things in conversation was the first thing that I thought about, but it is difficult. But it's about building the structures for these things to happen well. And I suppose it's about, as people that lead teams, it's about team and how we get the best out of people and how we motivate people. So a lot of it is the natural way in which we work in teams. But I think in science, sometimes we have these kind of, there are extra things that we have to think about, but I don't think any of those are insurmountable. I don't know if anybody else wants to reflect on that question.
Sorry, I would just like to say very quickly. I think one thing I would like to say is that you asked about giving it all. It's all about, when it comes from public partner perspective, it's all about how you set the scene, how you create the environment, how you make people feel, because I'm a British Pakistani gay Muslim man, and that's my whole identities. But it all depends on how I'm made to feel and how much I disclose about myself, and to get the best perspective and get inner perspective of people with lived experience from different intersectionality is to create an environment and create an atmosphere where they know that they will be celebrated as a whole and not just part of them.
Thanks, Hamid. We've got 30 seconds, so just a really quick question.
Is this? Yeah, it is on. Hello. Thank you very much for especially the tips and things on involving PPI and what's important to you. And I really benefit from that as an early career researcher myself. I just wanted to ask about, you've touched on how the landscape has changed, especially you, Peter, over the last 20 years. How would you like to see it change further if we looked ahead? What would you like to see for the future?
Okay, basically there are pockets of fantastic public involvement, yes, and yet there are still areas that need improvement, yes. So, I mean, you as early career researchers, you have a massive opportunity to spread the word, yes, because your enthusiasm is inspiring and it will radiate, yes, because there are people who've been involved in research for a long time who said we've always done it this way, yes, or we just give it to somebody, yes. Whereas in fact, your message can be really strong because you can take that message forward, yes? And certainly when I work with the NIHR Academy and we get the awards coming through, and you can kind of see, they talk about their supervisors. It's also up to the supervisors, isn't it, to recognise the importance. So what we've got to do is just make sure it's everywhere. In the same way people like Health Research Authority would involve public partners on recruitment and everything, yes? And NIHR the same, yes? We just want to spread that word so it does, permeate
Fantastic,
the whole,
Peter. Thank you.
the
We're
whole
spreading it
environment.
everywhere. That is a really, really good message to close on. Thank you so much, and we're looking forward to hearing from the early career researchers next.
Okay, everyone, we have our last round of lightning talks for the day. As usual, 3 minutes, then we'll have a brief Q&A at the end. So I'm looking forward to hearing from 5 of our SPHR trainees. We're going to start with Esther Curtin.
Okay. I'd like you to all imagine you're in your local supermarket doing your weekly shop, and there are hundreds of products on the shelves. How do you choose which to buy? Suddenly, instead of a notification from WhatsApp or Instagram, you get a message on your phone about the impacts of these products on your health and the health of the planet. Choosing what to eat is a situation we find ourselves in around 3, 4, 5 times a day, and it's an important one because we know that about half of the food we eat is considered unhealthy and often damaging for the environment. And that is why global communities advocate for plant-based diets with minimal amounts of animal-sourced foods like meat and dairy. My name is Esther, and I'm a public health PhD researcher with a passion for climate change, food security, and social justice. I'm not a tech expert, but I see mobile apps as one of the scalable solutions we need to improve what we eat, given we all spend around 3 hours on our phones each day. My systematic review and meta-analysis is the first that has looked at the effectiveness of mobile apps to facilitate behavior change towards more sustainable and healthier diets, and what strategies these apps use that can maintain user engagement over the long term. I followed a systematic process and found that across 21 studies and 74,000 people, app users reported a higher number of portions per day of fruit and vegetables and legumes and fewer portions of meat. When looking at the studies a little closer, as you can see on the second graph on the slide, I found that the change in portions per day were more pronounced in studies with control groups, which is encouraging as we can infer more causality from these studies compared to before and after or pre-post designs, and also in apps with messaging features, shown on the slide, which may be because they're more similar to social media type apps that are effective in maintaining engagement over time. So overall, what does this tell us? The evidence from my review shows that after using apps for an average of 8 weeks, people report positive changes to their diet, up to around 4 more portions of fruit and vegetables per day, a third of a portion of legumes, and 1 less portion of meat per week. So these changes may be important for meeting dietary guidelines on a population level. Messaging features may be instrumental in promoting this change, especially for meat, but the content of these messages is hard to say. However, there are still large variations in the effects. This may be due to variations in the initial motivations of the users, and also variations in the types of apps that are evaluated. These findings show to healthcare professionals and policymakers that apps may play a role in helping people kickstart healthy habits and could be added to a wider behavior change approach. I'll leave you with this question. Would you now consider using an app to help improve your diet? Thank you.
My PhD thesis asked the question, how do we determine the financial impact of population obesity on local authority budgets? When I was preparing for this talk, I searched in Google and I found two sensationalist tabloid headlines. One was Britain, the fat man in Europe, and the second one was, why are we so fat in the UK? Now, in reality, the Health Survey for England Statistics recently suggests that 1 in 4 people are obese within the UK. And actually, more than half are living with overweight and obesity in the UK as well. But that's not all. I was born and bred in Birmingham. So when people ask me what's Birmingham's claim to fame, one of the thoughts that comes in my head is we have some of the highest rates of childhood obesity in the country. Now, why is this all relevant? We know that obesity is associated with multiple sequelae, cardiovascular disease, associated with cancer, and the list goes on. Now imagine all of these individuals attend primary, secondary, and tertiary care. Now imagine the cost associated with that. And that's what a Frontier report has identified. In 2020, the annual cost of obesity in the UK was £58 billion. Now that's equivalent to 3% of the total GDP for the country. But one question is, that's the total cost for the UK. What about for local authorities? Local authorities have a remit to address obesity within their population, to address the determinants and inequity obesity by protected group as well. But local authorities are under major financial challenge. We know from the National Audit Office between 2010 and 2020, spending power of local authorities reduced by 26%. There's limited budgets, there's scarcity, and there's always opportunity cost in choosing one alternative over another alternative. And that's where my PhD comes in. We did a systematic review that was scoping in nature to determine the methodology of costing studies in the UK. We found a grand total of 1 study which looked at a small area-based level analysis. And even that was at an integrated care board level, not at the level of local authority. We also found that there's a multitude of approaches to model obesity. There's econometric techniques, there's using multiple data sources, but then there's also modeling. Now, modeling is quite useful because you can take different data sources and you can tailor them to the population of Birmingham. What else can you do with modeling? You can also say, let's create a hypothetical scenario where we reduce obesity by 1%. What impact will this have on budgets in the next 20 or 30 years? The next steps for my PhD are to engage closely with stakeholders within Birmingham Local Authority to identify the costs of obesity. But crucially, we also need to engage with the public to understand what is their lived experience of obesity, what are the challenges they face, and is economics capturing those, and will our model be able to capture those as well? Finally, I just want to say, I hope that in around 20 years, my PhD will have had some sort of impact. And hopefully when people ask me the question, what's Birmingham's claim to fame, I can say it has more canals than Venice. Thank you.
Hi, good afternoon. I'm Beth, a PhD student at the University of Exeter. It's really lovely to be with you today. I'm going to be talking to you about a review of reviews I've recently completed, which looked at the drivers of healthy versus unhealthy food choices. I thought it would be really fun to compare this with your own perspectives, so there was a form sent out in advance of this meeting today, which some of you might have filled out, and we will look at those responses in a bit. Very exciting, just to see how those compare. So having good diets is important for our health. Hopefully, we can all agree on that point. And we are all aware of the rising trends of obesity and poor diets. Now, changing population diets is a really complex thing to do, and this research is just one part of the puzzle, which hopes to support public health intervention development through increasing our understanding of the motivators of food choice. There's lots of research on drivers of food choice, lots of research which tells us about why people eat what they do, things like childhood diet, education. And what I felt that I could maybe add to this space was an overarching review which tries to pick out some of the similarities and differences when we look at food, not just overall, but for healthy versus unhealthy food, for different motivators, for different types of food. So that was my aim, and it was in adults across the high-income countries. So to ensure this presentation is 3 minutes and not 3 hours, I'm just going to show a little subsection of my findings. There were 59 included reviews, and you can see some overlaps. On the left is healthy, on the right is unhealthy, and these are the drivers, and some overlapping drivers. So, for example, believing in the health and nutrition benefits of food, being physically active and having healthy eating habits were all things which reviews linked with healthy eating. Unsurprisingly, things like a lack of time, a need for convenience, stress, dealing with tiredness and low mood were drivers of unhealthy food choice. And in the middle here, we can kind of see some of the overlapping drivers, which kind of might be bidirectional. So, for example, lower income was linked with unhealthier eating, higher income, healthy eating, and social norms could be supportive of either, depending on what those were. So let's see how these kind of compare with your own perspectives. For those of you who did fill out the form, I'm really grateful for those of you who did. So on the left is healthy again, and on the right is unhealthy. So similar to my review, some of you mentioned that valuing the nutritional content of food and valuing health was a driver of healthy eating, whereas tiredness and stress and a lack of time were drivers of unhealthy eating. Some of you talked about the fact that time drove unhealthy eating, which my review also found. But some of you, which is a little different, said that having time was a driver of healthy eating, and that wasn't reflected so much in my review, which was interesting. But what does all this mean for practice? So obviously, my review, like any review, is limited by the research which is included in that, and there are different or more drivers reported elsewhere. But what I'd really like us to consider, and the point I'd like us to take from this, is just the idea of considering the type of food when we're looking at drivers of food choice and how that could be used to support policy and interventions so that we are supporting the drivers of healthy food choice and tackling the drivers of unhealthy food choice. Thank you so much for listening.
Good afternoon, everyone. My name is Charan Bijlani, and I'm a PhD student at Imperial. Today, I'm going to be talking about understanding some of the drivers of food insecurity in England and developing a systems thinking conceptual framework. So, food insecurity in England, what do I mean by that? It's when residents don't have access to have financial or physical access to food that meets their cultural, social, and health needs. Oftentimes when we think of food insecurity, we just think of food access, but actually it means so much more than that. And this is a definition I developed with Westminster City Council. What we know is that food insecurity rates are on the rise, but we're doing lots about it. There's several policies out there, and we know a lot about the drivers when it comes to food insecurity, yet the problem persists. So we know lots of the drivers that impact food insecurity, and we know what food insecurity further impacts. But what we want to look at further is how do these drivers impact each other? So this is where my systems thinking comes in. Lucy did a great job this morning talking about systems thinking, causal loop diagrams, so that saves me a little bit of time, which is great. But when it comes to food insecurity in England, we can see that there's so much more, and we want to understand what these variables are and how they impact each other. So systems thinking focuses on feedback, and so I set out to try and understand what are these feedback mechanisms that exist. So I'm not going to go through all this because I don't know how much I thought I could cover in 3 minutes, but I conducted a literature review and aimed to develop a causal loop diagram myself. So I looked at all the variables, I tried to understand how they impacted each other, and then from this, I went back and refined my causal loop diagram, because if you know anything about causal loop diagrams, is that they are very messy and very complex, and they take lots of time to go through and reiterate and reiterate. But actually, one of the really exciting things about systems thinking is it's a participatory approach. And it's not just something that I do by myself and alone looking at the literature. So I set out on a mission to find subject matter experts across the country, some of which are even in this room, where I conducted 2 group model building workshops. Group model building is a methodology that's used in system dynamics, and it's very participatory as well. We follow scripts, and I'm happy to talk about this further at another time, where we went through with these 2 workshops to see what are these drivers and how do they impact each other, and what does everybody else see in the system? So that's what we're trying to understand when it comes to systems thinking, is each of us view the system slightly differently, and actually that's a real benefit of systems thinking. And how can we tackle this problem if we don't share each other's experiences and know what that problem looks like at the moment as well? That being said, we developed several different causal loop diagrams with these incredible experts. These are just a couple of them, and as you can see, they're very messy. We don't need to get into it anymore, where I'm hoping to use some of these findings further to conduct in-person workshops with Westminster City Council, with the voluntary charity sector in Westminster, and also with residents that experience food insecurity. Great. Thanks, everyone.
Hi everyone, my name is Irena Tetkovic and I'm a PhD student at the University of Cambridge. Today I decided to focus on the current project of my PhD, which is titled SibWell, which is about how to support siblings of children and young people with mental health conditions in their well-being. I started off my PhD thinking that I'd identified a gap in the literature and somewhat naively that within a couple of years I could just develop my own intervention and that would be the end of things. I do like that in the last 2 days we've spoken so much about creativity, because actually the favorite part about my PhD so far has been to creatively think about the issues and kind of the roadblocks within my PhD, because actually things are much more complex than I thought, and I had to shift my thinking around a bit, which I'll explain in a second. What do we know about sibling mental health? We know that children and young people with sibling mental health conditions are at risk for poor mental health. We know that a third of these siblings will have behaviors in the clinical range. We know that half of these siblings will have mental health problems themselves. And we know that these siblings are also at greater risk for depression and anxiety. Just like many people do in their first year, I decided to do a systematic review. I thought that it would make sense to look at what kind of interventions were already out there. I wanted to compare interventions to see which would be most effective. We scanned over 2,500 papers. In the end, actually only 4 papers screened in, and I think all of us here know that that's not a big number. And of these 4 papers, 2 each were actually focusing on one set of interventions. So more specifically, I compared family-based treatment for eating disorders with a sibling support group. The conclusion of my systematic review was that the evidence base was weak quality, and sparse. It was only 4 studies that screened in. And so when I thought about what to do next, I realized I couldn't really rely on the current evidence that we had because it was so weak. And instead, I thought what I could do instead was to think about what we're missing at the moment, which is more data, it's more information. So I'm really excited to say that just yesterday I submitted the ethics for my data protocol. I'll be doing a survey, again, that I called SibWell, to better understand what separates those siblings who cope well from those who struggle. So rather than thinking about what kind of interventions do we have, how do we improve those, I'm now thinking what sets those siblings apart who flourish from those who might need more support. So for that, I'll be recruiting 1,788 participants, going to be a big group, and then I'll also be conducting focus groups with them to gain more in-depth insight of what might help them so that we can then hopefully have better interventions in the future. Thank you.
Okay, we now have a few minutes for Q&A with our lightning talk speakers. Who would like to ask a question first? It took us until 5:20 to hit the awkward silence portion of the conference. Any questions for our speakers? Dougal.
Thanks. I wanted to come back slightly to the point you made in the last question about kind of the role of how our roles as researchers, what we bring to the research, and how when we're objective researchers and when we're activists. And Esther, I mean, you've come to speak to us. I know you kind of have those dual roles quite actively. I wondered if you had any comments on that as a kind of from a generational perspective, and whether any of the other speakers had any thoughts on that as well.
Yeah, that's a really good point. And I think whenever you're talking about environmental health and environmental justice, that does come into it. And I think Dougal's referring to, I was helping Rhiannon on a ResNet Award, which is about environmental activism in young people. So it's slightly different, but I think I'm very interested in that. So I think I have to be aware of that. Yeah, it's a good question. I guess one aspect of that comes into my research is looking at, so yeah, in terms of my climate-friendly apps that I'm looking at, it's like who were these apps actually developed by, and if there are any kind of vested interests there in terms of the app developers. I have extracted those data, but I haven't actually done an analysis on that because of the power, and it's all a bit complicated with the analysis. But yeah, I think there is a lot to say around commercial determinants in that realm, and food industry actors and things like that. So I would like to incorporate that a little bit. I'm not sure if it's going to be central to my message in my review, but I would like to look at that, and if there are more kind of activism apps out there as well.
Okay, next question. Gillian.
Thank you. Hi. Message for Irena? Yeah, thanks. Very interesting talk. Oh gosh, I've got a bit mind blank now. Oh gosh, I'm sorry, I've just lost the thread. Anyone else?
Peter.
I'll come back to you.
Thank you. Thank you. I'm Peter. I'm a public partner. Charan, I was very interested in food insecurity. Food banks, etc. We've had a massive, haven't we, increase in the number of food banks, and what role does that play in your research?
It actually plays a really huge role, and when we look at food aid policies, often our first thought is thinking of food banks. And how they're growing, the need is growing, donations are decreasing, and actually what was set out to be a temporary almost solution is actually not appropriate. It's going against what that definition of food insecurity I initially shared about how is it meeting people's cultural needs? Is it meeting their financial needs? Is it culturally appropriate? Is it socially acceptable that we're using food banks to put a plaster on this bigger systemic issue? And I think something that came out of the group model building workshops is actually looking at different types of food aid policies. Food banks are one, but actually there's lots of work being done in different areas, cash first approaches, food pantries, and actually exploring them differently. They're definitely not perfect. But it's something I'm hoping to explore more, because I think a lot of times we think food insecurity is synonymous with food banks, and I don't want that to be the case anymore.
It's come back to you, Gillian. Okay.
So before I forget, so Irena, so this is about siblings and how some siblings you want to find out how some siblings cope better than others in this situation. But when you do that study, it's just going to be like a moment in time, isn't it? So you may find that some siblings are coping well at the moment, but what happens in a year, 2 years' time? How do you have a follow-up plan? Is that going to be relevant to your study?
I think that's a really good point. Being a PhD student, unfortunately, I only have a limited time frame. So what I am doing right now is cross-sectional. So I will be only looking at siblings aged 18 to 26. And I'm asking them to reflect on how, so for instance, some of the things that I'm looking at, such as family functioning, which basically describes how comfortable you feel in your family, whether you can communicate with your parents, things like that. I'll be asking them to reflect on their childhood, how they felt about that. And so the outcomes that I'm looking at when I'm comparing those who maybe do better than others, that's at their current age, so age 18 to 26. So in a way, the things that I'm drawing upon, exactly like you've said, I'm asking these questions at one time point. So this is for them to reflect back on how things were. But what I think is really interesting about that, for instance, one of the things I'll be looking at is coping mechanisms. And I think that coping mechanisms are extremely complex. I don't think that just one survey can cover all of that. And I think that especially in childhood and in development as people in general, we change with lots of experiences, and we may adapt, we may develop different coping mechanisms. So then with the focus groups, one of the things that I really want to understand better is if we're also thinking about those who coped better, whether there may be some strategies that they've used over the years, maybe some things that have actually changed that meant it was easier or more difficult for them. So I absolutely agree. I think this concept of change is really important, and I hope with the qualitative work to capture that more.
Okay, that's all we have time for. Let's thank our lightning speakers again. And I'll hand it back to Ashley to close out the day.
Wow. It feels like a little while since I was here this morning, and that's because there's been so much new, so much different, so many different voices, different projects, and hearing from so many different people. So I haven't added up how many speakers we've had today, because it's a lot. It's more than 4 that you found in your systematic review, that's for sure. So first of all, Beth, I just want to say that we did have fruit at the break that didn't appear, but it will be outside, so it should be there for people to get when they leave. So apologies to that. I think I wanted to say that we've had so much happen today with our transdisciplinary placements, our pre-docs and our PhD students presenting. Tomorrow we'll hear from our launching fellows. We've got posters upstairs from all of our fellows. They're going to be staying there tomorrow, and please go in the morning to have a look at those if you haven't already, or go and have a look at the ones you haven't seen. Refreshments tomorrow will be downstairs because our breaks will be shorter, but the posters will be there, so do go and have a look. We've heard from 2 of our research programs. We've got 2 more tomorrow. We've had amazing local insights, but also important national insights from Justin Varney this morning, if you remember that. That was, I think, really powerful, looking at the information on our population, but then how that needs to change in terms of what policy and what we plan for the future. Public voice and public involvement that we've heard. Peter, your comments about 20 years and that journey towards that meaningful public involvement. It is a journey. I hope we're getting there, and we're developing partnerships, and I think we've seen some great examples of that today. I'm sure we've got more to do. We had a comment about innovation, and we've had from bubbles to crochet today. But I think some other innovations, I hope you agree, has been the placements that some of our fellows have talked about. And the fact that our fellows do the pre-docs and PhDs and launching fellows do placement in practice. And so that reverse of the transdisciplinary placements, of our researchers going into practice to understand what that's like and what people need, and make sure that our research is meaningful to people and can be used in practice and policy, and understanding those perspectives. So I think that's really important, and we'll hear about more innovations tomorrow. So I just want to finish by thanking all of our speakers, and for everybody who's helped today happen, because these things don't just happen with no organisation behind. There'll be more of that tomorrow. Some people are going for dinner this evening with the invitation of Fresh, so thank you very much. Anybody who did say they'd like to come should have had an email from Lucy Oakley about where it is and at what time. It's 6:30, just to remind everybody, so there isn't long. But if you're not sure, then please just hang around outside, and Penny May is here and will help. If you said you were coming and you're not coming anymore, or if you didn't say you were coming and you would like to come, again, hang around and we'll try and do some mix and match and make sure that everybody's happy, because that's what we want. Those of you who are going off elsewhere for a dinner tonight with colleagues and friends, have a wonderful time. We are starting earlier tomorrow. refreshments will be available from 8:30 outside, just outside here, and we have a 9 o'clock prompt start. So I look forward to seeing you all again tomorrow. Thank you for sticking with us for this long day. It hasn't really felt long, it's just we've packed so much in. And so have a lovely evening. See you back here, 8:30, 9 o'clock. Okay, thank you.